Hi, and welcome back to MedTutes. In today's tutorial, we're going to cover a little bit of an update on COVID-19. We're also going to discuss this concept of flattening the curve and what it actually means. It's being talked about a lot at the moment, and I wanted to spend a few minutes explaining what it actually meant, why it's so important. Before we go into that, I do want to just cover a few points. The first is that this is an incredibly difficult time for a lot of people. And there's a lot of people making a lot of very hard decisions. So I wanted to firstly say thank you to all the institutions that are making tough calls at the moment. There's a lot of people having a lot of sleepless nights. So thank you everyone who's working hard on this outbreak, trying to do the best by society and trying to do the best by their students. So in particular, I know a lot of med schools have had to make the difficult decision to withdraw students from placements. And I want to thank you for trying to keep your students safe, trying to keep our healthcare system safe. And thank you to all the people on the front line who are putting themselves on the line in order to help protect us against this outbreak. I also want to kind of make this point that, and we'll cover this a little bit later on, that now is not the time for panic. Panic doesn't really help anyone. So stocking up on supplies and locking your front door and never leaving is not necessarily the best option right now. We're going to discuss some of the ways to keep yourself safe and to help flatten the curve. But buying up 60 packets of toilet paper and filling your cupboard with 6 months supply of chickpeas and baked beans isn't the best thing to do in this scenario. Food security isn't necessarily a threat right now. And we're going to discuss individual risks versus population risks a little bit later on. I also want to make the point that with a lot of universities now withdrawing students from campus and with this move to online learning, there may be increased difficulty in accessing resources and asking questions. As a result of this, at MedTutes, what we're going to try and do is increase the amount of content that we produce. So there's a few ideas that I've got lined up for our podcast series Drug Bites, as well as a few more tutorials that I'm going to try and run via MedTutes. If there are any concepts that you want explained, that you want to be taught, please message the page. You can message us via our YouTube channel. You can also get in touch with us at Twitter. Let me just drop our Twitter account. So our Twitter is @MedTutes. You can get in touch on Facebook. That's facebook.com/MedTutes. You can get in touch via Reddit. User MedTutes. And finally, you can also get in touch via email as well. And our email is medtute@gmail.com. So if there's anything that you want covered over the next few weeks, please get in touch with the page. We'll work on developing those resources for you and try and increase the amount of resources available for people who are now having to study from home. If you just have one-off questions, please feel free to just shoot us a message via any of these pages as well, and we'd be happy to respond to just one-off questions. In this time, the most important thing we can do is band together and keep helping each other out. Great, so let's get started. COVID-19, what do we know? COVID-19 is caused by a virus called SARS coronavirus 2. SARS coronavirus 2 is very closely related to the SARS virus, which was involved in the SARS outbreak in 2002 in China. SARS coronavirus 2 causes a clinical picture that we have called COVID-19. So COVID-19 is actually the clinical syndrome and not the virus itself, but for ease of access, a lot of people are simply saying COVID-19 when they're meaning the virus. COVID-19 has a spectrum of disease. It ranges from a dry cough, fever, through to a viral pneumonia, and all the way through to an ARDS type picture. ARDS stands for acute respiratory distress syndrome, And it's these patients that are critically unwell and they require an ICU admission, intubation, and ventilation. So it can be very mild, and it kind of ranges through from completely asymptomatic through this dry cough, fever, potentially viral pneumonia, and ARDS. What do those numbers actually look like? It's very hard to calculate at the moment, but based on currently available evidence, and I should preface this whole shoot with this is an update based on what is currently available, and these concepts are going to change over time as more information becomes available, more epidemiological studies are conducted. But at the moment, we think around 80% of people are either asymptomatic or mild to moderate infection. So they're the people that are probably getting, they've got a mild cough and fever, or potentially a very mild pneumonia. They're not very sick. They likely don't need hospital admission, or they're completely asymptomatic. Around 15% of people, or around 15% of cases, are requiring an admission to hospital. And what are they getting while they're in hospital? Well, sometimes they need some fluid. Sometimes they need, most of the time they need some oxygen therapy, some supportive therapy, and in more severe cases, they're also getting some antivirals. In terms of which antivirals are happening and what we're currently giving, I'm going to make a Drug Bites podcast on this later this week, explaining which antivirals appear to have some efficacy in this condition. So keep an eye out for that. The podcast is called Drug Bites. And you can stream that wherever you listen. Around 5% of cases are requiring admission to ICU for critical care. And these are the patients that are developing ARDS, and they need to be intubated, so have a tube put in their throat while they're sedated, and they're kept on ventilation. What does this viral pneumonia look like? It's what we call an atypical pneumonia. Atypical, it's a bilateral pattern, and on CT scans and on chest x-rays like this one here, we see this ground glass appearance. So ground glass opacities. How does this vary from other types of pneumonia? Well, with typical pneumonias caused by bacteria, which is very common in the community, typically what we see is a lobar pattern. So you would just see, your lower lobe fully whited out. You wouldn't be able to see through it because it's filled with pus. What we're seeing in these pictures is a diffuse pattern bilaterally affecting both lungs, affecting all the lobes, and you're seeing this hazy ground glass type appearance all through the lungs. And that's typical of more severe viral pneumonias. So we see pictures like this with things like flu as well. Okay, so to cover that, SARS, range of symptoms going from dry cough or asymptomatic dry cough all the way through to an acute respiratory distress syndrome, which is a very severe presentation. Around 5% or less of people who get infected progress through to this stage. Most people are either asymptomatic or they have mild symptoms. Cool. Then we get to this idea of spreading the curve and what that actually means. So in both of these instances, the area under the curve is the same. So area under the curve is equal to the total number of people in the infection who are going to be infected. The difference is how quickly that we hit that number. Coronavirus, because it's a novel virus, there's nothing essentially stopping its transmission in the community. So if you remember from the last video we did on coronavirus, I discussed this idea of networks and how there's all these people that exist in a network. There was a really good diagram of this in a Washington Post article which did the rounds a few weeks ago. I shared it on the MedTutes Twitter page. I'll see if I can find it again and link it in the description of this video. But basically, if there's all these networks that all link together, and you've got certain nodes. So each of these dots represents a person, and each of the lines is like a connection that they have. With other conditions, people have pre-existing immunity because they've been infected before, or they've had a vaccine or something like that, which gives this element of herd immunity, which means that if this person has the vaccine, this person has the vaccine, this person's had the virus before, they've got some pre-existing immunity, and this person's been vaccinated. If this person gets infected, they can't infect that person, they can't infect that person, they can't infect that person, but they can go through and infect this person, and then so these people get sick, these people get sick, and then this person gets sick. However, there's lots of roadblocks, and those roadblocks slow down how quickly the infection can occur, and they also prevent the total number of people who get infected. We don't have that happening at the moment because SARS coronavirus 2 is a novel coronavirus. There is no pre-existing immunity within the population, and because of that, it can spread like wildfire. If that went on uncontrolled and we took 0 steps to try and control it, we would see this type of picture that we see here, where we see a very rapid increase in the number of cases, and it kind of hits its peak and then it drops off rather quickly. Now, although this means that the total length of the pandemic is decreased, what we see is that our hospitals can only treat a certain number of people. And when this kind of picture occurs, even though only 20% of patients will require hospital admission and only 5% max are going to require an ICU admission, if that 5% or those 20% of people that require hospital admissions all come in at the same time, we very quickly overwhelm our hospital's capacity, and this is when people die. This is what's happened in Italy. Italy had a very rapid increase in the number of cases, and they found it very difficult to control and get back on top of the spread. Because of that, they had a lot of sick patients coming in all at once. At the same time as this is going on, you still have patients coming in with stroke, with heart attacks, with trauma, even things like appendicitis, gastro. For the Southern Hemisphere, we're going into our influenza season. So people are going to be coming in with flu as well as coronavirus. So all these things mean that there's increased strain on our health system. And if we don't lengthen the time over which the pandemic occurs, we're going to face this scenario where our hospitals are very rapidly overwhelmed with patients, and they're limited by what they can do. You run out of ventilators, you run out of beds, you run out of drugs. What we want to do is we want to try and slow how long this pandemic occurs for. By doing this, the total number of patients that get infected is the same, but we see it spread out over the next couple of 6 to 8 months potentially. And what that means is that at no point does our hospital system get completely overwhelmed. So we don't run out of beds, we don't run out of ventilators, we don't run out of drugs. It allows our hospitals to keep up with demand. They can still keep seeing the strokes, the appendicitis, the heart attacks, all those kinds of things. And it means that our hospitals can survive this outbreak. This brings us to the idea of individual versus population risk. So the reason that we are doing all these steps, such as social isolation and lockdowns, we are not doing these because there is increased risk to the individual. The risk to the individual of getting infected is probably moderate, but as you saw, 80% of those people are going to be fine. They're going to get probably a nasty flu, but they're not going to require hospital admission. What we're more worried about in a pandemic is the population risk, and that refers to the risk to the healthcare system. So the reason that we're implementing things like social isolation and lockdowns is because we want to limit the strain on our healthcare system and remove the risk of overwhelming the hospitals. So let me say this again because it's really important. The risk to self is relatively low. Lots of people are going. That's not to say that you should be complacent and it doesn't matter if you get sick. It does matter, and there is still the risk that you are going to get sick and you could potentially get a nasty illness. However, the main risk that we worry about in these scenarios is overwhelming our healthcare systems, and that means that more people get sick and more people can't be treated because everything is overwhelmed. So that is why you don't need to be stocking up on cans, and you don't need to be stocking up on supplies and having your house filled with cans and toilet paper and all that kind of nonsense, because it's unlikely we'll face a situation where no one is going to be able to leave, no one's going to be able to get food, and it's not like if you do get the virus, you've got a 100% chance of dying kind of thing. The reason we're doing this and we're encouraging social isolation, we're encouraging self-isolation if you show symptoms, is more because we want to make sure that we spread this curve out over a long period of time. I'm going to discuss Australia's pandemic response plan for a second, because I think it kind of illustrates these points quite nicely. So Australia's plan has 4 stages, and I'll just cover the first 2 because I think they're the most relevant for now. So stage 1 was all about limiting spread to Australia. So this occurs when there's a low number of cases within Australia, and most of the cases within Australia were caused by people traveling and bringing the illness in from other countries. So in this stage, what we were trying to do was limit the number of cases that got introduced to Australia. We did that by, enforcing 14-day isolation when people got back from overseas. We did it by screening at airports. We did it by screening, so anyone that had symptoms following an overseas trip or to higher risk areas got screened and they got isolated. We took people from the cruise ships and from when we evacuated people from China, and we placed them on Christmas Island for 14 days. All those kinds of steps were about limiting income into Australia. The reason for that is that by doing those steps, what we could do is we could actually move this line here up a little bit. The way that we did that is we started getting our hospitals prepared. They started stocking up on PPE, so personal protective equipment. They started stopping elective cases. So we stopped people coming in for procedures that could potentially wait, so that we could free up beds. We could start buying more ventilators and getting ventilators out of storage and getting everything ready. We could activate overflow capacities within hospitals, prepare other areas to become critical care areas so that our ICU capabilities are increased. And we started training people in PPE and all that kind of thing. All these things in preparation so that once the virus does hit and we start to hit a peak, we've actually lifted how much we can deal with as well. That was the aim of stage 1, was all about giving hospitals time to prepare and to lift that kind of stage. What we're starting to see in Australia is we're starting to transition into stage 2 of the plan. In stage 2 of the plan, this is when community spread is starting to increase. But what that means is that we're now starting to see cases within Australia in people who have no contact with others who have had international travel. So it's no longer people that are getting sick in Australia. It's now becoming more common that they haven't traveled overseas and they haven't had those sick contacts. As this starts to occur, we need to start increasing social isolation measures. So we're starting to encourage social isolation. And that's things like working from home. We're limiting events greater than 500 people outdoors or 100 people indoors. And in reality, it should be even more than that. We're limiting all non-essential gatherings. For example, even churches, the Catholic Church made an announcement last night in Australia that all masses would be postponed until further notice. and encourage people to have their own prayers and masses essentially in their own home without big gatherings. And we're encouraging people to stop handshaking, hugs, other forms of close contact with people. So you see people bumping elbows or fist bumping at the moment, all in this kind of goal of preventing community spread. Again, the idea of this is not that you lock yourself in your house and you don't leave. If you don't have symptoms, you probably shouldn't. If you have symptoms, you probably shouldn't go outside. But if you don't have symptoms, you're still free to move around, go to the shops, go grab a coffee from your local coffee shop, go out for dinner, all those kinds of things. As long as you're maintaining your 1.5 meters of distance from others around you, you're not touching your face. That's a big one. And you're engaging in regular hand hygiene. If you don't have symptoms, you're still free to go do all those things and to do your shopping. If you do have symptoms, you should stay home until your symptoms resolve, or until 2 weeks afterwards if you are a high suspicion for COVID. But during that time, you still have family and friends which can come drop food off for you. You can still order food online, everything like that. Locking everything down and preventing everyone from moving isn't necessary right now. And if we practice these steps really well, hopefully we won't get to a stage where we do have to completely lock down everyone. That brings me to another point that I might bring up just in regards to coronavirus and SARS coronavirus 2. How is it spreading? At the moment, it's via droplets, and droplets lead to contact spread. It can also be spread fecal-orally. So droplets. Droplets are created when people cough and sneeze. When people cough and sneeze, the virus gets deposited in these droplets, and the droplets typically land around 1 to 2 meters radius around the person who's just coughed. As they settle on surfaces, and so if people breathe it in while they're in the air still, they can get infected that way. But more likely is that it touches things. It gets left on tables, it gets left on keyboards, people rub their noses and then keep typing. Those are the ways in which viruses get onto surfaces. The virus can then survive on the surface. At the moment, it's unclear how long that is for. Some evidence currently suggests around 7 days. And if it's not cleaned in that time, when people touch that surface, it gets on their fingers, and then people touch their face. They touch their eyes, their nose, their mouth. They eat without washing hands. They go and shake hands with other people. And all those kinds of things help the virus to spread. Because of that, the key things that you can do to stop the virus, it's not necessarily wearing a mask. The way that masks probably help is that they stop people from touching their face. Really, the best thing you can do is good hand hygiene, and stopping touching your face. That's the biggest thing. Like, if you stop touching your face, you maintain good hand hygiene. If you cough or sneeze, you do so by turning your head into your elbow and covering it all up. If you use a tissue, throwing the tissue out and washing your hands. All those really, really basic things are the best way to stop transmission. If you do end up going into a GP or a screening clinic or something like that, you're likely to be given a surgical mask. The surgical masks are so that when you cough or sneeze, you limit the droplets which can get out into the environment. That's the point of the surgical mask. It can be spread via aerosols during aerosol-producing procedures. That's things like CPR and intubation. These are the cases in which you need the N95 masks. But you can imagine if we keep using N95 masks for every patient or anyone that could potentially have it, or if we're just using N95 masks when we're walking to the shops, what that's going to do is it's going to deplete our stockpiles of N95 so that when we really need them for people who need CPR or need to be intubated, supplies are going to run low and we're going to put our health staff at risk. So that's why if you're going to use a mask, really you don't need to, but unless you have any kind of symptoms. If you have symptoms, you should probably be using a surgical mask that's properly fitted. That's probably good enough. Make sure you keep washing your hands. Make sure you don't touch your face. All right, so a quick review of everything that we talked about. SARS coronavirus 2 causes COVID-19. Most people have a very mild infection, but a significant proportion of people need to be hospitalized or admitted to ICU. The current fatality, again, varies, but current studies suggest potentially between 1 and 3%. So out of every 100 cases, potentially 1 to 3 people may die. People most likely at risk are the elderly and those with comorbidities. However, there are cases of people who were previously young, fit and healthy with no comorbidities who are requiring intubation and admission to ICUs. So people in their 20s, 30s and 40s. These, I will stress, these are less likely than those who are elderly. However, the risk is not zero to people who are below 65, essentially. The kind of picture that severe kind of cases get are this viral pneumonia and ARDS picture. And the best thing that we need, what we're aiming to do at the moment, is spread this curve out over a longer period of time. The way that we're doing that is via social isolation, working from home, avoiding touching our face and avoiding close contact with others, maintaining good hand hygiene. You don't need to be stocking up on supplies. You don't need to be locking yourself in a bunker for the next 3 months. We need to be sensible. We need to avoid panic. And most of all, we need to keep supporting each other in these times of stress and hardship. Remember that the people most affected by these panic buying and hoarding behaviors are likely to be people with a low socioeconomic background and also healthcare workers who are likely to be working during the day and not have time to go buy the supplies that they actually need to go home and have dinner with their families. So look out for each other. Don't panic. Support each other, and remember that we will get through this. We have great research teams all over the world who are working on vaccines, new antiviral drugs, new methods of treatment. If we stay sensible, we will make it through this. Thank you for listening. As always, you can get in touch with us via any of our social media accounts, Twitter, Facebook, Reddit, or email. We'd love to hear from you. You can also look on the website medtutes.wordpress.com for many more resources that we're going to keep pumping out over the next few weeks. Keep an eye out for the Drug Bites podcast on the antivirals we're using for COVID-19. And if you have any questions, please let us know. Thanks so much for listening. Stay healthy and keep washing those hands.